Anyways, we're live here. Hi, Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. And we have Tiffany here. And Tiffany, gosh, there's a story to it. I'm not going to get 100% right, but the story is that you had some hip pain, low back pain. You've been to other providers. And I thought there was some conversation on the table, hey, possible surgery. Was that true or not true?
Yes, and MRIs and
You did a lot of stuff.
Yeah, 3 different doctors, 4 different doctors, and they just kind of gave me the runaround. And the last one told me to come to chiropractic, and it has been phenomenal.
That was one of the best things. I mean, we're not 100%, but we're definitely more functional and got you back to work, functioning pretty quickly.
Yes.
Guys, this is what I found with Tiffany that I see most commonly with patients. We were doing some work in the SI area, some of the pubic symphysis area, and the hips, and she had some great results with that and reducing some of the pain symptoms, got her functioning again, and back out on keeping our streets safe again. And one of the things when I'm looking at actually the pelvic height, and you can see how the spine slightly turns this way. Hip is high on the left side, lower on the left, or lower on the right, I should say, right through here. This is going to affect, one, this is part of her, when she's in the job, she's behind the vehicle, or in the car, behind the wheel, getting in and out, foot on the gas pedal, and so you can see, it looks like her body's twisting here. This is from just how she sits throughout the day and kind of the work hazards. Now we're looking at where the leg length is. This is one of the things that we look at to see where there's discrepancy. And right there you can see the motion. So right here, discrepancy in how much misalignment there is in the spine. You can see how one leg moves further than the other. So we have a misalignment toward the sacrum. I'm going to actually pressure test this area. And Doc, you may want to back up just a little bit on that. So I'm actually pressure testing the apex of the sacrum. Both legs are even, and she can bend them even further. I'm going to have you back up that way. Mm-hmm. There you go. So we're going to adjust the sacrum and pelvis for her. Right SI joint. And so that relaxes some of the quadriceps. You got a pretty good gouge right there. What were you doing, a mud run or something?
Beach volleyball.
Lay on this side for me. Now we're going to adjust the left SI joint on this side. So bend right here. Did you have fun?
Yes.
Did you win?
I was just practicing.
All that from practice?
Yes.
Okay, we're going to open up that joint. Leaning in, pelvis. Good, right there. Opposite side. Here. Bring the sacrum back around. And Doc, you can show this right where my hand position is, right here. We're contacting apex of the sacrum. Right there. Face down. Just by aligning those areas, I started out a little bit of traction and heat. Huge difference even in range of motion just from getting that aligned. All right. And we're adjusting upper dorsal, cervical area. I want you on your back. Crossing this over. And through here. Checking the thoracic spine for misalignment in that area, right through T4 through 6. And right here, breath in, blow out, lift your head. Very good. All right, now we're checking for motion in the neck. I want you to squeeze your knees together right here. Good. Any pain?
No.
Relax. So when I did that test, we're testing the pubic area. A lot of times that is part of the pelvis, but a lot of times people will get hip pain, low back pain because of a misalignment right through this area, right through here. Good, looks good. All right, I'm gonna have you sit up and face that way for me. So Tiffany's been coming in about every couple of weeks now, as she needs to. What did it take us? About a handful of sessions to get you really back in alignment? And what have you experienced afterward since treatment?
Well, even the first day after treatment, I was able to function and walk properly again, and then the more that I came, I could tell a drastic difference at work.
Even like during your shifts?
During my shifts, I wasn't experiencing pain all shift, and
Like before?
yeah, like before, it was awful.
And you had a chiropractor down in Camus, didn't you?
Down in Longview.
Longview. Okay.
She was fabulous.
Lots of good chiropractors out there, guys. So if you need help, find someone that you can work with and does a good job. So anything you want to share with what your experience has been here at the office?
My experience has been great, professional. I would recommend Dr. Warwick to anybody for sure. Definitely has helped me. I wouldn't go anywhere else around here, so thank you.
Yeah, you're welcome.